My name is Boniso Numalo. I will start by introducing my members. We have Dr. Shabalala, we have Nurse Koane, we have patient Mr. Tusini, then we have a patient family member, Mr. Villani. Dr. Shabalala and Nurse Koane are examining Mr. Tusini, who has been rushed into the emergency room.
Nurse Ngwane, what is the patient's blood pressure?
The patient's blood pressure is at 190 over 120, doctor, and he has severe hypertension.
We need to act quickly. His symptoms suggest that we might be having a myocardial infection. Prepare for biopsy if needed.
Is he going to be okay, doctor?
We are doing everything we can, Mr. Villani. Right now, our priority is to stabilize him and prevent any complication. His prognosis will depend on how he responds to the treatment in the next
Mr. Villani, can you please wait for us outside? Doctor, he's developing a rash and his breathing is becoming labored. Could it be anaphylaxis?
It's possible. Let's administer a pine and prepare for intubation in his airway closes.
The team acts quickly, and Mr. Brown's breathing stabilized after the epinephrine shots.
Breathing is stabilized. We need to achieve homeostatic for the bleeding.
Good. Now let's monitor for any signs of sepsis. Nurse, start him on broad-spectrum antibiotics.
Yes, doctor, I will also call the lab to get the pathology report expedited.
Mr. Villani, your brother is receiving the best care. We will continue to monitor him closely and update you on his progress.
The scene ends with the medical team efficiently managing Mr. Tusini's critical condition, using their specialized knowledge and jargon to communicate effectively and provide the best care possible.
I'm Mr. Nako and I'm with our patient, Mr. Ngumalo, and our paramedic, Mr. Tusini, and we have our nurse, Dr. Nurse Villani, and our Dr. Shabalala. Yeah. Then our scenes open when the emergency, the paramedic takes Mr. Ngumalo into the ward and the doctor will take care of him. Our patient has a heart attack. The scene opens with Mr. Brown being wheeled into the emergency room on a stretcher by the paramedic. He's clutching his chest and appears to be in severe pain.
Dr. Chabalala, we have a 23-year-old male presenting with severe chest pain, shortness of breath, and sweating. He is hypertensive and we suspect a myocardial infection.
Thank you, Mr. Tusini. Nurse Villani, please get an ECG to start monitoring his vitals immediately.
Right away, doctor.
Nurse Villani starts attaching electrodes to Mr. Numalo's chest for the ECG. Meanwhile, Dr. Chabalala addresses Mr. Numalo.
Mr. Numalo, I'm Dr. Chabalala. We believe you are having a heart attack. Try to stay calm. We are going to take good care of you.
Breathing heavily.
I can't breathe. My chest it hurts so much.
I know it's painful, Mr. Numalo. We are giving you medication to relieve the pain and help your heart. Nurse Villani, administer 300 milligrams of aspirin and start an IV with intraglycerin.
Administers the medication. Mrs. Numalo rushes into the room visibly distressed.
What's happening to my husband? Is he going to be okay?
Your husband is having a myocardial infection, commonly known as heart attack. We are doing everything we can to stabilize him and reduce the damage to his heart.
The ECG machine beeps and Nurse Villani looks at the results.
Doctor, the ECG confirms an ST elevation myocardial infection.
Thank you, Nurse Villani. We need to get him to a cadet lab for an emergency angioplasty. Nurse, call the cardiologist to prepare for immediate transfer.
What does that mean, doctor?
An angioplasty is a procedure to open a blocked arteries that are causing the heart attack. It's crucial to restore blood flow as quick as possible to minimize heart damage.
The team prepares to move Mr. Numalo to the cath lab. Mrs. Numalo holds his hand.
Oh, stay strong, honey. I'm right here with you.
Mr. Numalo responded weakly.
I love you.
Alright, let's move team. Every second counts.
They wheel Mr. Numalo out of the room and Mrs. Numalo follows closely. The scene ends with the medical team efficiently managing the emergency and moving quickly to provide life-saving treatment.